when you're injecting people with toxin, it's very safe. You know that the effects are going to wear off in 3, 4, 5 months. So even if you're not completely satisfied with what's been done, you know that it's going to go away and there's not going to be any permanent effect, injury or whatnot. With fillers, I think that you have to approach them a little more conservatively. It is true that they are reversible with an enzyme that we can put in. However, you'd like not to go that route always, because it's a waste of material and time and expense and so forth. There are some risks with fillers that aren't present with the toxins. And the main one that everyone's worried about is something called vascular necrosis or vascular occlusion with skin necrosis. And essentially what happens is that a small amount of the filler actually gets into a blood vessel, which then denies blood flow to an area of the skin, and that area of the skin can die. And it will scar if that happens and may need grafting or, cause a permanent deficit. And that's not something that you're looking for when you're coming in to have yourself look pretty, look younger. And so the way I usually approach filler is incrementally. I'm going to listen to the client, the guest, patient, and see what their concerns are, what they want addressed first, and then talk to them about the risks and what we might try and where they're likely to get the most initial benefit or effect from the filler. And then just start with a small amount, 1, maybe 2 syringes into the areas of greatest concern. And then wait and see how things settle, see how it integrates into the underlying soft tissues, how much water it takes up, because the appearance will change subtly over the course of the following weeks. And then when they come back, can see what they'd like to have adjusted. They can see the evolution themselves in the mirror. And as they're seeing those changes, they can decide what else becomes important to them and what else they'd like to sort of modify or shade about their appearance. And I think when you go from 0 to 100 all at once, number one, if you're injecting a ton at once, your risk goes up. And you don't always know exactly what you're going to wind up with when you do that. You can always inject more. You can always put more in. But it's harder to take some away. You can't just take some away, in other words. Once you put it in, if you put the enzyme in to dissolve it, it's all going to dissolve. You can't just dissolve part of it and back it up a little bit. It's all or nothing. So I'd like to get there gradually. It's safer, and I think it results ultimately in a better result and a happier patient.